Hello, Jokers. Thanks for watching this episode of Jokers Physiotherapy. Today, I want to talk to you about jaw and thyroid and the strong link between the two. So, jaw and the thyroid have been known to have a strong link between the two. Unknown exact etiology, the reason for it, the science behind it, but suggests that it's most probably antibodies develop and that attacks the jaw joint. Don't know why jaw joint is attacked, but in thyroid disease, often there are different types, but one is called a hypothyroidism, where too much thyroid has been produced. A thyroid, by the way, is a hormone. Um, especially in females, this can be disrupted, but also in men as well. Graves' disease is one that is well known, where there is too much thyroid hormone. But I see more commonly in hypothyroidism, where there's low thyroid level, and in a form of, say, Hashimoto's thyroiditis or chronic thyroid inflammation, and that is often more common in female than male, for sure. More than hyperthyroidism like Graves' disease that I have seen more men, but maybe more equal men and women. But in hypothyroidism, it's definitely more common in terms of the symptoms I see in jaw in females. Not sure why. They are both autoimmune conditions, and obviously that can mean there is some inflammation that can cause problem around the body. And in this instance, we're talking about the jaw, so it's in the jaw joint. These inflammatory episodes, it's not just once, and it may be even not painful while it's inflamed because it's so small. But when you have years or repeated or number of inflammatory episodes, that causes scars, because when it inflames, it can then settle down, the body tries to heal, and that can cause scars inside the jaw joint. But when you have number of episodes, the scars become very, very much formed and matures, which causes stiffness in the jaw joint. The inflammation of the jaw joint means it may also disrupt or erode the joint surface of the jaw joint, which is made up of cartilage, and that means over time it can contribute to arthritis of the jaw joint itself. Arthritis itself can also trigger more inflammation. So it's like a cascade of events. And by the time you realize the symptom, which may often be pain, it may be quite advanced. So if you do have a jaw problem, and then also have thyroid issues, because obviously if you have thyroid issues, you will also have other non-jaw related symptoms such as fatigue, unexplained sweating. Best thing is to go and seek help from your doctor and at least get it checked out, that it is, whether it's is just purely jaw problem or there is thyroid issues or other things that are going on. The earlier you can find out, the better it is. And we still don't know why jaws are affected strongly, but the best explanation is the anatomy. Jaws right here on either side in front of the tragus of the ear is the jaw joint. And the thyroid, especially hypothyroid, doesn't mean both jaw joints are equally affected. It could be one side more affected than the other, but we don't know why one side is often more affected. Maybe because of the previous history of clicking or in the jaw joint, who knows? But this happens over many years. So it's very hard to put the history together, but when you examine and talk to the clients and examine properly, hear their story in a chronological order, that may be the story. And they're all close to each other. Jaw joint, thyroid, which is just here in the throat area, very close. Okay, so make sure you see endocrine doctor, which is the hormone doctor who can help you examine, diagnose, and treat thyroid problem. But physio can still help. In which area? It's with jaw stretching specific to your knees due to the scarring, how the jaw moves. So we can look at the jaw movement quality and improve them through stretching exercises, quality of movement exercises. Often involves tongue training, how you breathe, things like that. Jaw positioning, you might feel like, oh, my bite is out, where your teeth don't meet well and you don't feel comfortable. So these are the things. If it's to do with the jaw, physios can help. Rehabilitation will help. And the scars in the jaw joint, capsule and ligaments can be helped by doing some exercises and stretching and improving the quality of movement. So, thank you for watching this episode of Jorka's Physiotherapy. If you like these videos, please give us thumbs up or please subscribe for more videos. I've already got about 90 videos, most of them related to the jaw and some of them related to the migraines because often they are linked. So, thank you. And if you have any questions or comments, please leave them in the comments section below. And happy rehab. Cheers.